Be aware of Legionnaires. The year was 1976. In Philadelphia at an American Legion convention, a mysterious epidemic of fatal respiratory disease left 183 people infected and 29 people dead. After further research, the alleged cause of the epidemic was a bacteria found in the air conditioning unit cooling towers. However, this was never fully proven. In 1977, the bacteria was identified and named Legionella, supposedly after the outbreak. This invisible bacteria colonizes best in water, such as water used for showering, hot tubs, decorative fountains, and cooling towers. Therefore, outbreaks of Legionnaire's disease have been found to be connected to buildings with complex water systems, such as hotels, long-term care facilities, hospitals, and cruise ships. Currently, Legionnaire's disease accounts for only 2 to 9% of pneumonia cases. 75 to 80% of reported cases are found in people 50 years and older. 60 to 70% of them are male, and only less than 1% of cases are found in children. So, how is Legionnaire's disease contracted? The Legionella bacteria is inhaled as an aerosolized particle. This means that the bacteria travels through moisture within the air. After inhalation, the bacteria travels through the respiratory system and into the lungs, where it is met by the macrophages. But what is a macrophage? Macrophages are a type of cell within your immune system. They are a type of immune cell called phagocytes, which means they engulf foreign particles or cells, or anything that doesn't express protein markers of a normal host cell. Things such as cancerous cells, foreign particles, and in this case, the Legionella bacteria. In the case of Legionnaire's disease, once engulfed, the Legionella multiply within the macrophage, which causes the cell to die. The bacteria are then released and can infect additional cells. But how did the bacteria get into the air? Unlike how you may assume most respiratory infections are spread, the spread of Legionnaires generally occurs through environmental transmission rather than person to person. Wet environments, referred to as reservoirs, are hosts of Legionella. These reservoirs can range from aquatic ecosystems to humidifiers. When contaminated, water is aerosolized, and it can be inhaled and therefore cause infection. Testing the disease is relatively straightforward. It is diagnosed through a lab test called UAT, or urinary antigen test. This test is similar to a pregnancy test, detecting molecules of Legionella bacterium found within your urine. If, for example, a patient has pneumonia, uses this test, and tests positive, showing 2 lines, then you can confirm that the patient does have Legionnaire's disease. Legionnaire's disease manifests as an atypical or abnormal pneumonia, which is an inflammation of the lungs caused by infection. It resembles other bacterial pneumonias, including the most common type, pneumococcal pneumonia, caused by the pneumococcus bacteria. However, Legionnaire's is often more severe. While Legionnaire's disease may be mild, it can also be severe, requiring hospitalization and possibly resulting in death. The mortality rate of Legionnaire's disease is 8 to 12% for the general population. However, risk of death is even higher in some subpopulations, such as the elderly, those with pre-existing conditions, those who smoke, and those with delayed diagnosis and treatment. Additionally, if individuals catch Legionnaire's disease in hospital, the mortality rate increases to 15 to 34%, much higher than the general population. The incubation period, or time it takes for exposure to begin the symptoms, can range from 2 to 14 days. In this time, individuals have prodromal illness, which includes symptoms before manifestation of the main onset. These prodromal symptoms include headache, myalgia or muscle aches, weakness or lack of energy, and loss of appetite. Once an individual develops Legionnaire's disease, they display a range of clinical manifestations and symptoms, since Legionnaire's has no specific defining clinical features. The most common symptoms include fever, cough, and relative bradycardia or slow heart rate. Additional symptoms include chills, pleuritic chest pain, which is chest pain caused by the inflammation of the pleura, the lining that separates the lungs from the chest wall. Additionally, the presence of gastrointestinal symptoms or neurological symptoms, along with the pneumonia, is a major indicator that a patient might have Legionnaire's, as opposed to any other type of pneumonia. The GI symptoms include diarrhea, nausea, vomiting, and abdominal pain. The neurological symptoms include headache, reduced alertness, or consciousness, and seizures. Legionnaire's disease can also have non-respiratory symptoms, such as inflammation of the outer or inner lining of the heart or heart muscle, called pericarditis, endocarditis, and myocarditis. There also may be an enlarged spleen or spleen rupture, wound infection, arthritis, or central nervous system infections. Legionnaire's disease is treated with antibiotics. Early treatment will decrease chances of experiencing serious complications or hospitalization. The antibiotic is a single oral treatment that is effective against Legionnaire's pneumonia and has many different types. For immunocompromised patients or patients with possible allergies, there are other medications that could be required. Although outbreaks of Legionnaire's are preventable, it requires water management systems in buildings to ensure that the water is cleaned and monitored regularly. Legionnaires can also grow in the home, within pipes, faucets, and shower heads, so proper precautionary measures must be taken. Thank you for watching our video on Legionnaire's disease. Check out our other videos on Demystifying Medicine's YouTube channel.